Good afternoon, everyone. Welcome to our 2:15 afternoon news conference here for the City of Grand Forks. We have a quite a large panel here this afternoon, so we'll go through our panel giving their comments, 2 to 3 minute comments, and then we'll go to a 15-minute Q&A from the media. From a media standpoint, please be sure to use your raise your hand feature so I know to call on you. And we will get started. Again, my name is John Bernstrom. I work in the Public Information Office for the City of Grand Forks. And if we can get this kicked off with Mr. Mayor Brown.
Well, good afternoon, and thank you for tuning in and staying informed. Knowledge is power, and it's important to follow reliable sources and avoid misinformation as we continue to mitigate the spread of COVID-19 in Grand Forks County. Here's your daily reminder on physical distancing. The best way to prevent illness is to avoid being exposed to the virus. That is why you must stay home. The spread of the virus is determined by our personal choices, and we must take responsibility for ourselves and our community. In addition to the current measures, the CDC is now recommending wearing face coverings when in public settings. I've only made 2 essential trips to the grocery store this week, and when I did, I used this to cover my face and washed it when I got home. We'll take this precaution to protect both ourselves and others, and I strongly encourage you to do the same. Mitigation efforts are being federally supported, state-led, and locally executed. As Dr. Fauci has communicated, the current measures in place in North Dakota are functionally equivalent to shelter in place, the orders in other states. We're following the leadership of Governor Burgum at the state level and ready to act further locally should it become necessary. We will continue to do that based on facts provided by state and local health officials and communication with Governor Burgum and his team. We know it's Easter weekend, a time usually spent with close friends and family. Our message to you remains the same. Stay home and avoid large family gatherings. If you do not do it for your own health, do it for the health of your loved ones. This virus does not discriminate, and nobody is an exception to the rule. Putting family and friends at risk is not worth it, and all of us are at risk of getting and unknowingly spreading COVID-19. Now is the time to be North Dakota smart. I encourage everyone to have a virtual Easter by participating in religious services online and connecting with family and friends over video conferencing if possible. Physical distancing does not mean social isolation, and social connection is so important, especially during the holidays. We have seen religious leaders and organizations adapt by providing virtual services over the past few weeks, and no services are planned for the same this Easter. We're so grateful to have a dedicated, passionate, and understanding faith community in Grand Forks that is putting the health of their congregations first. Thank you to our local businesses who have adapted their business models and are exercising policies and practices to keep the public and employees safe. They're even offering family-style Easter meals for delivery and takeout. They're making tough decisions, and I encourage all Grand Forks citizens to continue supporting our local businesses. The city's community development team continues to work with these businesses and our local, state, and federal partners. They're actively interfacing with our business community in the effort to identify local gaps and ways to complement the variety of state and federal programs where appropriate. Our sincere gratitude goes out to our congressional delegation, Governor Burgum and his team, and our local partners for their work and responsiveness to our local business needs. Next, let's talk about city operations. Our flood protection project is doing its job, and city staff is executing the flood action plan. The current hydrograph shows we've crested at 47.5 feet, which is within our flood protection project, and we are prepared to adapt to changing circumstances as we move forward. Our engineering department and public works and water crews are true unsung heroes who do their job in such a dedicated, humble, and professional manner. We thank them for all their work protecting and serving our great community. The police department continues to monitor, educate, and community police during this pandemic. They ask you to continue to stay alert and protect your personal property by taking necessary security measures. We wish everyone a safe and healthy holiday weekend. Continue practicing physical distancing. Stay home, slow the spread, and save lives. We're in this together. We will get through this together, and together we'll emerge stronger. Thank you.
Thank you, Mayor, and my apologies to the rest of our panelists. I forgot to introduce you. Following Mayor Brown here, we'll hear from UND President Dr. Josh Wynn. We'll then hear from County Commissioner Cynthia Peach. We'll hear from Colonel Cameron Pringle from the Grand Forks Air Force Base. We'll hear from Dr. Terry Brenner from Grand Forks Public Schools, and we'll hear from Dr. Josh Deere from All True Health System. So let's go next to Dr. Josh Wynn from the University of North Dakota. Dr. Wynn.
Well, thanks very much for that introduction. Thank you, Mr. Mayor. Very much appreciate being part of this discussion and part of the greater Grand Forks community. So the University of North Dakota is very grateful for its partnerships with the city, the county, All True Hospital of the base, and the entire region. And one of the things I want to emphasize is that the University of North Dakota remains open and functional, but as the mayor indicated, we're just operating under a different rule book. So our students are still getting educated, albeit through distance mechanisms, online and so forth, and not in in-person classes. But the students have persevered. Our faculty and staff have done a terrific job in supporting that. And we're very proud for the contribution that the university is making to the community. But I would echo the mayor's caution to not let our guard down as far as the fight against COVID-19. It's getting beautiful outside. The river is cresting and will be headed down. This is an important holiday weekend where we often get together with family and friends to celebrate and pray together, but we need to do that virtually. We should not have large gatherings of people other than through the internet or on the telephone and so forth. We should not do that in person. There'll be time enough for that in the future. For now, remember what the mayor said, be North Dakota smart, not just North Dakota tough, but North Dakota smart. And that means by you continuing to practice physical distancing, you're not only protecting yourself, perhaps just as importantly, you're protecting your family, your neighbors, your friends, and your colleagues. So let's combine North Dakota tough with North Dakota smart. Let's continue to physically distance, but not socially or emotionally distance. And as the mayor said, together we will get through this, we will learn from it, and we will be better for it on the other side. Thank you for allowing UND to be part of the community. We are pleased to be here, and we look forward to continuing to work with our friends and partners in the community. Thank you.
Thank you, Dr. Wynn. We'll head next to Grand Forks County Commissioner Cynthia Peach.
Thank you very much. On behalf of the county, I want to thank all our different programs that continue to operate. County Social Services, our public health department has done an excellent job in testing and keep providing information to our citizens. Again, as citizens, if you've been around someone who you know has the virus, don't be embarrassed. Don't be afraid to tell your employer, to inform those that you're connected close to or around. We need to stop the virus. We need to get a handle on it. And it's not a bad thing if you've been around someone, but inform people of that so that you don't spread the virus unknowingly. Stay home, be safe. We continue to watch flooding in our county. Please be aware of that. It's not a bad idea to get your family out and get fresh air, but stay away from others. Don't let your children go to a neighborhood and play a neighborhood basketball game. Playing within your own family unit is okay, but it's not okay to have a bunch of kids together, maybe sharing the virus and then taking it home to others. That's important, and it's hard to do. Our children want to be outside. We need to be outside with them, spend time with them, and do a lot of fun activities together. It is a holiday weekend, and we do want to celebrate that, but we want to celebrate that in a little bit of confinement. As far as the county goes, we're still open for all services. You need to call ahead. We're not opening our county building at this time to anyone, just essential staff, so that we need to continue with our programming. We appreciate your support, and we appreciate the opportunity to provide the necessary services for you even in this time of a pandemic. And I will say that there are positive things going on. Hopefully we're not communicating with our immediate family by phone, but please hook together, link in with them, have family conference calls with your extended relatives and friends, even your neighbors, so that we can make sure that we can finally move beyond and flatten the curve, as they say. Thank you very much for your support.
Thank you, Commissioner Peach. We will go next to Colonel Cameron Pringle from the Grand Forks Air Force Base. Colonel Pringle.
All right, thanks, and thanks, Mayor Brown, for the opportunity to communicate with the community out here. We certainly appreciate all the great support that we at Grand Forks Air Force Base get from the greater Grand Forks community every day, and particularly during events like coronavirus. So our priority out here at the base is like everybody else's. We're looking to protect our airmen, protect our families, and protect the community. And we're doing a lot of that the same way that everybody else is, by staying home. And we've taken some steps to get our airmen and their families into their homes, just like everybody else is doing. But as you know, we do have a few missions out here that we have to conduct, some essential missions that still have to go on. I always say we still need to fly, fight, and win in airspace and cyberspace, and we are doing that. We're getting those jobs done, but we're doing it in a smart way in order to make sure that that we are mitigating the risk, minimizing the spread as much as we can. And you know, whether it's things like wearing a mask, we're doing that when we have to get into a situation where we're close to each other, or just taking those steps to maybe limit access to who's in what buildings and limit access to the base a little bit. Anybody that needs on the base for official duties is still getting on, and we've still been able to keep the base open to ID card holders who need groceries or the household essentials, and we're going to hope to keep that going as long as we possibly can. But again, the base is strong, and we're ready for what comes next. I would say, just again, thank you to the community for the opportunity to thank you again for all the great support every day. Coronavirus is a tough enemy, but we're ready for this. We know what to do, and we appreciate the opportunity to stand shoulder to shoulder with the community, and we'll get through this together.
Thank you, Colonel Pringle. Now to the Grand Forks Public School District and Dr. Terry Brenner.
Thank you, John. Good afternoon, everybody, and thank you for allowing me the opportunity to speak on behalf of Grand Forks and Grand Forks Air Force Base school districts. We just completed our 7th day of distance learning, and our average daily attendance hovers between 94 and 96%, which pretty much mirrors our face-to-face type of education, traditional education program. Our teaching and support staff have been absolutely outstanding through all of this. It's a new lens for everybody to work through and to teach through. And so far, so good. It's not without a few hiccups along the way with some of the technology challenges, but we do have a technology hotline that parents can call, that students can call. We have a very small skeleton crew at the Mark Sanford Education Center providing technology support. We have curbside drop-off, curbside pickup for devices that aren't working or devices that have been damaged. And if anybody needs connectivity, hotspots, etc., we are providing those for our families as well. And just a large shout out to our parents who are taking on a brand new role in their home environment as their child's first teacher. One thing we know about the research is the most critical resource in a student's education is the classroom teacher. There are no other influences that provide the trajectory for that student other than the classroom teacher. And now parents are taking on that job side by side with either content teachers or classroom teachers. So thank you, parents, for working with us, hanging in there when things don't go as smoothly, and not giving up when it's easy to do that. I'd also like to just indicate that the Mark Sanford Education Center is down to very much a bare bones crew. Just a few people are left out there. I already highlighted the technology piece, and then a couple of human resources folks are there to answer questions for anybody who might have questions about payroll. Otherwise, most people are working remotely at this time. Lunches and breakfasts continue to be served by our outstanding child nutrition department led by Emily Carl. We're handing out anywhere between 1,700 and 2,000 lunches and breakfasts per day. So we're keeping that going and keeping families healthy Monday through Friday. And the big question that we get asked all the time is, when will the reunification effort be? And we will just reserve that for Governor Burgum to provide that proclamation. But until that time, it will be distance learning at its best right here in Grand Forks. And I'm just really, really proud to be part of this panel and to be part of Team Grand Forks as we all grow through this and get through this together. Thank you.
Thank you, Dr. Brenner. And we will, as far as the comments, we will wrap up with Dr. Josh Deere from Altru Health System. Dr. Deere.
Yeah, good afternoon. I'm Dr. Josh Deere, Medical Director of Primary Care at Altru. On behalf of Altru's leadership team, I want to thank you for another opportunity to share important updates with the community. As outlined by Mayor Brown, Altru would like to thank the community for the exceptional job they're doing with physical distancing. We continue to have minimal strain on our health system and a low number of cases related to community spread. Although we still have work to do, the actions we have taken have appeared to flatten the curve in our area. Physical distancing is a key strategy to preventing spread of COVID-19. We encourage this to continue over the holiday weekend, as you've heard many say. My children would love to see their grandparents. That said, we're going to settle for a Zoom meeting with family, church via live stream, a nailed it bake-off. If anyone's watched Netflix, it's going to probably turn out pretty poorly, and some takeout from a local restaurant for our Easter meal. Technology has allowed us to socially stay together through this time when we are physically distanced. If you know someone with a small support network, now is the time to reach out. We want to promote physical distancing, but not social isolation. The impact on mental health during isolation can be significant. Now is the time to get creative and keeping loved ones socially engaged. At Altru, we continue to focus on keeping you safe. If you visit Altru, you'll see our staff wearing masks. We're providing procedural masks to all staff beginning today. The CDC, as you saw Mayor Brown say, if you're out socially, you should be wearing a cloth mask or one that you can make at home. We continue to have our teams ready to safely care for you. Our sick clinic, virtual care options, primary care and specialty clinics continue to care for patients in the appropriate setting. The COVID hotline is a resource for our community, and we encourage you to contact it 24/7 with any questions you need. Other sites for information would be altru.org/coronavirus, Grand Forks City and County websites, North Dakota Department of Health website, and CDC. They will update everything as this is an ever-changing situation. Plans are in place for caring for our patients in the hospital setting with a tiered approach of care based on our community's needs. These changes at Altru are necessary to maintain safe care and keep our health care workers safe as well. We appreciate the outpouring of support from the community. Please remember that the best way to thank us is to continue to follow the current recommendations. Thank you.
Thank you, Dr. Deere. We'll now, for our 15-minute period, we will start with our Q&A from the media. First hand in the air from the Grand Forks Herald, Mr. Joe Bowen.
Yeah, hey, this is a question I suppose mostly for Mike here. What do you suppose, or what have you been told the coronavirus's financial impact on the city government has been thus far? And what do you suppose, or what have you been told its impact will be on the city government going forward?
No, that's an ongoing number, and Marina's researching that right now. I haven't received a final report.
All right, thank you, Mayor. Question, Mr. Bowen again.
Yeah, hey there. I guess ultimately at the core of that is, as of right now, do you anticipate that any city staff will be furloughed or have their hours cut or maybe even lose their job based on what you know at this moment?
At this moment, we're evaluating it, and we'll see what comes of that. But right now, after 20 years of cutting 40 mills, we're down to a mission essential people. And I think that everyone is working very hard to continue to protect and serve. And the people continue to need and require what the city provides. And so we have the crew in place. And no, I don't see any immediate changes in our staffing.
We have a question from KNOX from Mr. Sweeney in the newsroom at KNOX. This is, I believe, directed to Dr. Josh Deere. You've seen the efforts in Fargo with the Fargo Dome and the University of Mary potentially being sites for extra beds. Is there anything similar going on in Grand Forks?
Not necessarily exactly along those lines, but when you get to those steps, you're working with your state health department, and they're helping facilitate things along with your state guard. So we do have a 3-tiered approach, which would rapidly expand our beds and our ICU capabilities, but nothing specific along those lines as to utilizing a convention center as another location.
Thank you, Dr. Deere. A question from the City of Grand Forks Facebook page. This is for Mayor Brown. With churches working to think outside of the box and maybe doing almost like a drive-in theater type mentality and not leaving your car, do you feel that is still meeting CDC guidelines, or what are your recommendations from a city perspective?
Well, the recommendations from a city perspective are stay home. And why? Because that 6-foot rule, if the wind is blowing wrong, it could be 30 feet. And when people are out in their cars, it's like, hey, let's go shopping. Hey, let's go get gas. Hey, let's go do that. No, stay home. And then you can visit with family over the electronic means. The message from the city is stay home. Don't spread the virus. The virus doesn't spread itself. We do. Stay home. And that now is not the time to lower your guard. We haven't had a new case in like 4 days. Thank goodness, because people are practicing staying home, and that's what we encourage. So the message is stay home.
Thank you, Mayor. Mr. Joe Bowen.
Yeah, hey, I think this is a Terry question. That 94 to 96% attendance rate you mentioned earlier, my impression is that's district-wide. What is Grand Forks Public Schools' attendance rate been among students who are using one of those district-provided hotspots?
Yeah, I don't have it disaggregated that way. We only have it collated K through 12, so I'm not able to answer that question, Joe.
And another question from Facebook. This is for Dr. Deere at Altru. Thank you for the work you're doing. Is Altru in need of any donations?
Yeah, if you want to know how to help, you can go to our altru.org website, coronavirus link, and there's actually a community support link on there. So if the community wants to reach out, they can go through there.
And then another one for Dr. Deere while I have you up, sir. What are the protocols for testing?
Yeah, as we've talked about on here, the protocols for testing have changed based on guidelines. Obviously, in an area where there's community spread, there's going to be a lot more testing. We're continuing to test those that have fever, those with multiple symptoms, and the symptom list has widened now to include conjunctivitis and some other symptoms. So 2 or more symptoms or fever without known cause. Obviously, in a hospitalized patient, there are a lot of different scenarios where we'd be testing or screening patients, but those are the patient populations we're testing at the current time. I expect that to continue ongoing, and at the current date, we have 132 tests pending, and we've completed 1,131 tests in the Grand Forks, East Grand Forks local area in our sites.
Thank you, Dr. Deere. I see a hand raised from Chris Larson from the Flag. Go ahead, Chris.
My question is for Dr. Deere. I got an email from a listener that's asking why there's so many people that are showing symptoms that are being told they can't be tested and to go home and call if they get worse. Can you speak on that at all?
I can't speak to the specifics on those particular patient encounter. I can speak to that if patients like that would be calling our COVID hotline, the majority of them would be screened. You have to understand we're a border state. In Minnesota, they have a lot less testing supplies at this time. And a lot of people with symptoms in their state, they're just saying to basically shelter in place, monitor symptoms. If symptoms worse, they'll be seen.
Thank you, Dr. Deere. Hand raised by Mr. Joe Bowen.
All right, hey, so this is one of those Facebook questions we got. Might be tricky to answer, but how much does a coronavirus test cost? Maybe before insurance, something like that.
I'm looking at Dr. Deer for this one.
Yeah, the testing is free. So I can't tell you the actual cost, but to the patient, it's free.
Okay, then easy answer on that one. Anything else from our media, Mr. Joe Bowen?
Yeah, hey again. So on Monday, Mike, you're saying you strongly discourage group gatherings, even small ones. How does that compare to the 10 that seems to be the magic number for the governor himself? Like it seems like it's smaller than 10. Is that the case?
I would and reemphasize the importance of not spreading the virus. People spread the virus, it doesn't spread itself. So you're taking a risk, and that's what we said before. You want to minimize your risk to yourself and the community. So there's no magic number like 1, 3, 5, 7, 10. They want you to keep the group small to lessen your risk of exposure, but then some people interpret that, oh, I'll have breakfast with 10 people, lunch with 10 people, supper with 10 people. Then you've got 30 people you're exposed to. So again, these cities' messages: stay home, avoid groups, and help us get through this together. Because now is not the time to lower our guard.
Thank you, Mayor. Hand raised by Mr. Chris Larson.
This is for Mayor Brown. Mayor, when you look at eventually opening the city again, do you anticipate that being in a staggered approach, or how do you expect that's going to happen?
Well, it's good that the city that plans for recovery will recover faster, and so that's why we're having our business listening sessions and our United Way and nonprofit listening sessions to help us get to that point. We will follow the guidelines that we have seen that is working in other cities and states and places, that how we bring our city back. So I would expect a gradual approach to get our things up in place, but we'll see that when it happens. We'll do that as it comes.
A question coming from Facebook for Dr. Deer at Altru. To the best of your ability, Doctor, this is probably more of an HR question, but for employees that have lost hours due to being sick and working within COVID, what is Altru doing to provide assistance to those employees? Is that something from an Altru standpoint? Again, it's more of an HR question. I understand that, but it is a question regarding Altru.
So if you're being quarantined specifically for COVID exposure, we're covering the pay for those patients.
Thank you, Dr. Deer. Hand raised by Mr. Joe Bowen.
Hey there. So it sounds like the NHL might host some games at the Ralph, or at least that's the rumor. And at least it might do it if the league figures out it's safe enough to play those games without fans in the stands. From strictly a public health perspective, would a game like that, a fanless hockey game, so to speak, be safe?
Boy,
I know Debbie's not here.
Unfortunately, we don't have public health here. I'm struggling a little bit. I do have 3 doctors in front of me, 4 doctors in front of me. So, anyone want to take a shot at this one regarding, from a public health standpoint, not even public gatherings, but sporting events?
Oh, I'm sure there'll be a lot of discussion regarding this, because there's no event like that is without risk. So do you test everybody before they play? Would another player want to play with another player who's not been tested? That's why they canceled the events in the beginning, because this is a very serious, life-threatening virus. So I don't see us putting anybody at risk, but we'll have a long discussion before that happens.
Thank you, Mayor. And now we have, we're going to take 2 more questions. First, we'll go with Mr. Larson with the flag.
This is for Dr. Brenner. What has the response been from your students and parents with the distance learning to this point?
I would say generally positive. If you follow the social media posts, there have been a number of tweets, Facebook posts that have been awfully positive in my face-to-face conversations. More than 6 feet away from my neighbors, for example, they're thrilled with the experience that their daughter's getting, not only from the academic standpoint, but from a co-curricular perspective as well. Somebody who's involved with strings, orchestra, and band, doing virtual lessons that way. So I would say by and large, it's been positive. I think it's just the the structure and the makeup and the schedule at home that's been a challenge, probably mostly for our elementary age students, and the amount of supervision that it requires from adults in the household.
Thank you, Dr. Brenner. Okay, I lied. We'll do 2 questions from now on. One question coming from Facebook for Dr. Deer. When it comes to testing within the Altru system, how many sites are doing the testing?
Yeah, we're doing testing in our region and in Grand Forks. So there's Devil's Lake, our sick clinic, which includes drive-by testing. There was testing in Thief River, also testing in Roseau and Crookston.
Thank you, Dr. Deer. And our final question during the Q&A, Mr. Joe Bowen.
Hey there. So Minnesota's Chamber of Commerce is trying to get the state to delay property tax collections for businesses. There's a deadline in May, and their proposal would push that back to July. Is anyone here aware of any plans or proposals to do the same or similar in North Dakota? And could you do something like that just in Grand Forks?
That would be a policy-making decision that would have to come before the council, but I know of no plans at present.
Okay, and with that final question, thank you, everyone. Thank you to our panelists, Dr. Deer, Dr. Wynn from UND, Colonel Pringle from Grand Forks Air Force Base, Cynthia Peach, Grand Forks County Commission, and Dr. Terry Brenner for Grand Forks Public Schools. We very much appreciate it. And as we have done in these news conferences in the past, Mayor Brown, could you please give your final thoughts?
Well, my final thoughts, it's with Dr. Brenner on the phone, on the line. I had someone yesterday teaching kindergarten to his daughter, and he said he learned a lot of information from that. So it's there's an upside to this, plus bonding with your family. But again, this is not the time to lower our guard. This is the time to continue to keep our community safe. This is the time to stay home, slow the spread, save lives. Thank you.
Thank you, Mayor Brown, and thank you for everyone for participating today. Hope everyone has a good Easter weekend, visiting with family remotely. And there's going to be lots of phone calls this weekend. We hope everyone enjoys it. Thank you very much, and good afternoon.
Thanks, everyone. Thanks, Mr. Mayor.